Hello, viewers. Welcome to today's series with Dr. Sam of the Health Sentinel. And today we'll be talking about dementia. And dementia is a syndrome usually characterized by progressive nature in which there is deterioration in cognitive function, there is the ability to process thoughts beyond which might be expected from the normal aging, and it affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. And consciousness is also not affected. However, impairment in cognitive function is commonly affected and accompanying. Dementia results from a variety of diseases and injuries that primarily or secondarily affect the brain, such as Alzheimer's disease or stroke. And then talking about the signs and symptoms of dementia, dementia affects each person in different way depending upon the factors of impacts of the disease and the person's personality before becoming ill. The signs and symptoms of depression are linked with not depression. The signs and symptoms of dementia are linked with many things and they could be misunderstood. However, early stages include forgetfulness, losing track of time, and becoming lost in family places. That's the early stage. And in the middle stage, the dementia progresses to the middle stage, and then the symptoms and signs becomes clearer and more restricting. And some of the symptoms and signs include becoming forgetful of recent events and people's names, becoming lost at home, having increased difficulty with communication, needful with help in personal care, experiencing behaviors changing, including wandering and repeated questioning. Okay, and then there's a late stage of the symptoms and signs of dementia. And the late stage of dementia is one of the near total dependence inactivity, and the memory disturbance are serious, and physical signs and symptoms become obvious. And some of these signs and symptoms include becoming unaware of time, place, and person, having difficulty recognizing relatives and friends, having increased needs for assisted self-care, having difficulty working and walking as well, experiencing behavioral changes that may escalate and even cause aggression. And then those are the signs and symptoms of the dementia. Worldwide, around 50 million people have dementia, with nearly 60% living in low and middle income countries every year. There are nearly 10 million new cases. The estimated population of dementia are the people aged 60 and over, and the incidence is between 5 to 8%. So that's it with the rate or the epidemiology. And then we'll be talking about the treatment and care. Well, the sad news is there is no treatment currently available to cure dementia or alter the progressive course. Numerous new treatments have been investigated in various stages of clinical trials. However, much can be offered to support and improve the lives of people with dementia and their caregivers. The principal goals for dementia are to diagnose this disease early enough in order to promote early and optimal management, optimizing physical health, cognition and activity and well-being, identifying and treating accompanying physical illnesses, because most of these diseases come with comorbidities as well, detecting and treating challenges, behavioral and psychological symptoms like aggression and other things like depression as well, providing information and long-term support cares. So these are the treatments, like I said. Now, talking about the prevention, many of us know that it occurs in the elderly, and as such, there's a need for us to prevent the risk factors. And some of the risk factors known are, although age is the strongest risk factors for dementia, like I said earlier on, and it is inevitable. And further, the dementia does not exclusively affect older people. Young onset of dementia is defined as the onset of dementia before the age of 65 years, accounts for up to 9% of the cases. And studies shown that people can reduce their risk of dementia by getting regular exercise, not smoking, avoid harmful use of alcohol, controlling their weight, eating healthy diet, maintaining healthy blood pressure, cholesterol, and blood sugars. Additional risk factors include depression, low educational attainment, social isolation, and cognitive inactivity. With this, I hope I've been able to enlighten a bit on dementia and how to prevent it in the young population. Thank you.